Good afternoon, everyone. Alisa, Haushalter, Director of the Shelby County Health Department, and welcome to the Joint Task Force update. I hope everyone's had a happy holiday. We will have two updates this week on Tuesday and Thursday, as we typically do. Today I'm going to give updates, but I'm going to spend most of my time talking about vaccinations and answer some questions that have been posed to us. Then Dr. Randolph will provide some additional updates on Health Directive number 16. And then we have a special guest with us, David Williams, who's going to speak to the importance of blood donations, particularly at this time of year. So as of this morning, we've had 66,084 cases. That's an increase of 371 over a 24-hour period. However, we do know that over the Christmas holiday, there was less testing. While testing was available and people got tested, there were a lower number of people that were tested. And so we want to wait and watch the numbers really for the following week to 2 weeks and not have any premature assumption that numbers are going down because of the small number of 371 in 24 hours. Unfortunately, we've had 861 deaths to date, and that's still about 1.3% of those who have been diagnosed with COVID. We continue to see the greatest proportion of cases in individuals under 44, and particularly that age range of 20 to 44, but we are seeing cases increasing in individuals above 44, and that indicates to us that there is transmission from that younger age group to the older age group, and so it reinforces the importance of all the safety protocols that we have in place locally. And then when we look at the places that individuals are employed who have COVID, the manufacturing and warehouse industry at the current time has the highest proportion of individuals who report working in that industry, and that's about 23%. Healthcare is second at 21%, and schools third at 11%. Just want to reinforce that we have plenty of testing capacity locally. We're continuing to encourage people to know their status, get tested, and do testing as often as you would like. It's important that if you test as soon as you know that you're positive, that you follow all the isolation orders that prevent additional spread. And while our healthcare systems and hospitals particularly continue to be stretched, they are meeting the needs of this community. So we want to reinforce the message that if you need medical care, seek medical care. The hospitals are adapting to make sure that they provide the necessary services for our community. And then I want to talk specifically about public health capacity, and then talk within that about vaccinations that are being delivered by the health department. We continue to do contact tracing. We are not discontinuing that. Even though there's a focus on vaccines, we need to continue to focus on containment, and that's done through contact tracing, but also through our partnerships with others. We are also continuing to work on enforcement. Many of you are aware that the County Commission passed an ordinance allowing the health department to issue a fine, which is a step prior to closure. We are working on the protocols to be able to implement the fines as needed, and so more to come on that. And then we've obviously added the vaccine campaign, which we anticipate we will be involved in well into 2021. At the current time, we're actually looking about 6 months out. We started vaccinating yesterday what is called the 1A1 population, and I'll list in a moment who falls in that category. And we're doing that at 2 closed pods. And closed means that only those who are invited or fall in that category can get vaccinated at those 2 sites. And we were able to vaccinate over 800 people yesterday in a 6-hour period. And we had over 700 appointments for today. So I want to thank our first responders, our law enforcement personnel, and others in the 1A1 category for showing up and getting their vaccine and demonstrating the importance of getting vaccinated and knowing that that's really the light at the end of the tunnel. We want to get at least 70% of our population vaccinated, and so it's going to take everyone stepping up. I wanted to review who currently falls in the 1A1 category. We're getting a lot of questions about the priority categories. There's several places that one can go for information. One is the Tennessee Department of Health website. They have the full state plan on their website. We will be updating our website with new information because we understand that the Tennessee Department of Health will be making some revisions to the priority categories, likely to be announced today, and if not today, then by tomorrow. So the 1A1 category includes anyone who works in a hospital or a freestanding emergency department, that staff who have direct patient care and direct patient contact. They also are individuals who work in those facilities who may have exposure to potentially infectious materials. So, for example, individuals who take specimens for COVID. Anyone who works in home care. Anyone who does testing at the COVID community sites are eligible in the 1A1 category. Those who provide healthcare services in schools, so that would be the school health nurses and others that have direct contact for patient care or student care activities. Staff and residents of long-term care facilities, and then first responders with direct public exposure. We do anticipate that that list may be revised slightly, but that's the current priorities. And then within those groups, the following individuals have highest priority. Anyone over the age of 65, individuals with comorbid conditions, so that would be cancer, chronic kidney disease, chronic lung disease, having had a solid organ transplant, people with a body mass index of greater than 30, those with serious cardiac disease, those with sickle cell disease, and those with diabetes. So the focus now is on the 1A1 population, and as we get through that population, we will move to the 1A2 population. And then today there are some specific questions we've continued to receive, and we will post a fact versus fiction frequently asked questions on our website, but want to address some of the specific questions that we're receiving. The one question is government mandating that everyone receive the COVID-19 vaccine? And the answer is no. Particularly in the state of Tennessee, it's not a mandatory vaccine. And at the current time, I know of no employers who are mandating it for their employees. In some cases, employers are requiring their team members to receive education about the vaccine so they can make an informed decision. Our role in public health is to provide information so that those of you who are eligible for vaccine have the information to, again, make an informed decision. The second question has to do with whether or not the vaccines are safe because they were brought to market in such a rapid manner. All vaccines in the United States have to go through a series of trials, and then the FDA reviews those trials or research studies to determine efficiency, effectiveness, and safety, and all of those measures have to be met before a vaccine is allowed to be on the market. And so while this has come to market quicker than most vaccines, it is safe, and the FDA has approved it for its current use. The other question is about severe side effects from the vaccine. All vaccines have the opportunity to create side effects. They are generally a very small portion of people who are vaccinated, and that's similar with the COVID-19 vaccine. In the trials, there were some reactions that were brought forth in the research. So an example, someone may have a tenderness of their arm for a day or so, or someone may have a mild headache for a day or so. Those are typically managed by over-the-counter medicines, but are not unusual for any vaccine. The last question has to do with whether or not these include a live virus and whether they can cause you to actually have COVID-19, and the answer is no. The two vaccines that are on the market currently, Pfizer and Moderna, are a very new type of vaccine called an mRNA vaccine, which does not contain live virus at all. So I'm going to end there. I want to make sure we have sufficient opportunity for questions today. I anticipate there will be more questions about vaccine. So again, turn it over to Dr. Randolph and then David Williams.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. Dr. Bruce Randolph, I'm the health officer for the Shelby County Health Department, and I also will only want to take a few minutes to highlight some things so that we have time for questions. First thing I want to remind everyone is that as effective December 26th, Directive number 16 and the Safer at Home order took effect. And the purpose of that is really to try to slow down the spread of the virus and to end the surge that we're experiencing. And I just want to remind everyone to go to that directive and health order and specifically pay attention to what you as an individual, a business, and services are required to do. One thing I want to remind businesses that if you're not listed in that health directive as one that should be open, you are closed. We have included a frequently asked question to further explain the fact that it is primarily the entertainment and recreation aspect of businesses that we are asking that people try to avoid crowding and gathering. And in the website, in our health directive, you will find answers to what types of businesses should remain closed. Some examples, this is not necessarily complete or exclusive, but museums and zoos, tourist attractions, arcades, game rooms, theaters, movies, hookah and cigar lounges, trampoline parks, entertainment and event centers, convention centers, concert halls, bowling alleys, and pool halls. These are some examples. But even within these businesses, if you serve food, you can continue to serve food. It's the recreation and entertainment aspect of the business that is currently closed. Also, I want to remind restaurants that you close at 10 o'clock. I understand that New Year Eve is coming up, but businesses, especially your restaurants, must be closed at 10 as directed in the health directive. The other thing that I want to remind also restaurants, live entertainment and live performances are not allowed. No dancing, standing, or gathering. We're permitted restaurants to have indoor dining at 25% capacity with limited 90 minutes, people wearing a face mask except when actually eating or drinking. But the live entertainment aspect and live performances are not permitted at this current time. Last thing I want to remind all employers is that you have a responsibility and obligation to provide for your employees adequate PPE, adequate personal protection equipment. And that equipment, the PPE, must match the risk of the exposure that they are facing in the workplace, particularly in some of the personal care businesses where by nature of the business you're providing, the customer has to have their mask removed. Those workers who are working doing facial and other types of activity must have at a minimal a mask and a shield that adequately protect them. And in some instances, depending on the risk, it may even require a N95. So per the health directive, per regulations of OSHA, you must provide adequate protection of your employees. With that, I will stop and introduce to you Mr. David Williams. He's the regional director of Vitalant, and he is going to come and talk to us about blood donations. Mr. Williams.
Good afternoon. My name is David Williams, Regional Director of Vitalant, formerly Lifeblood here in Memphis. Vitalant is primarily responsible for the safety and sustainability of our community's blood supply to 18 Mid-South area hospitals. COVID-19, cold and flu season, winter storms, and holiday activities have negatively impacted blood drives, as well as the number of individuals who are healthy and available to give blood. Across the U.S., nearly 1,900 blood drives in December and coming up in January have been forced to cancel because of COVID-19. That translates to about 45,000 anticipated donations that did not happen. Locally, dozens and dozens of Vitalant blood drives have been canceled, and local donations in December alone are down by nearly 700 units. While the country and the metro area face new restrictions, the need for blood doesn't stop. The U.S. Surgeon General, FEMA, and our own Shelby County Health Department have declared blood, platelet, and convalescent plasma donation, as well as blood drives, to be essential activities during the pandemic because patients continue to depend on blood transfusions every day. Vitalant is regulated by the Food and Drug Administration, the FDA, and as such is held to the highest of safety standards and protocols. This is the case whether you donate at a blood drive or in one of our 5 Memphis area donation centers in South Haven, Germantown, Bartlett, East Memphis, or in the medical district. If you've never donated blood, or if it's been a while, the need is greater now more than ever. With so many canceled drives, the need for businesses, churches, schools, government agencies, nonprofits, and other community entities to step up and host a drive, it's critical. Remember, one donation can save up to 3 lives. We encourage everyone to visit vitalant.org and schedule a blood drive or donation today. Thank you.
Thank you, David, for joining us today. And I just want to remind people there's always a need for blood year-round, but at the holiday season, it's particularly needed, not just because of illness, but because of traumas that people may experience. So we want to reinforce that donating blood is an essential service and remains open and encourage people to donate as they are able. So I want to go ahead and open it up for questions.
Shay Arthur, WREG.
Hi there, I hope you had a great holiday. I know it's been a little bit more than a month since there was the issues with the club in Love Memphis, and it was discussed that there was going to be an internal investigation to basically what went wrong, why the party wasn't shut down essentially. What were the findings of that investigation? Because I know looking at the inspector's report, there was some discrepancy between what was in the report and what we saw in pictures, and then also the club was shut down for about a week or so. Did they receive any other penalties? And then I have another follow-up question.
Sure, so it's a great question. I just want to clarify, actually what we look for is opportunities to improve. It's not necessarily what went right or wrong, but how can we learn through the experience from a quality improvement perspective to carry out our duties to the best of our ability. And there were several things that we believe contributed. One is that the activities were occurring under a tent, and so some lack of clarity for the inspectors as to whether or not the tent was viewed as an outside or inside enclosure. And then internally in the decision to close, there was a lot of consultation that was needed, clearly between myself and Dr. Randolph, as well as some other team members, as well as our legal team. And so in my opinion, the decision to close came a little bit later than I would have preferred. But those lessons have all been applied. Training has been done with staff. We have protocols in place, and obviously the facility was closed. Mr. Givens did comply with all of our requests. One, to provide information on those who had tickets from that evening, as well as to have a reopening plan to be in compliance. And our ultimate goal is for activities to be in compliance with the health directive, and I believe we achieved that in the end. Do you have a follow-up?
Yeah, just you kind of going off that, because I know that this sparked a lot of discussion with commissioners and kind of almost giving the health department more teeth in enforcement. And you're talking about, going ahead, working on protocols for implementing possible fines. Is it still $50 fine per violation? And what are some of the discussions that you're having about that?
Sure. So the actual ordinance that passed stands as it is. So it's $50 per violation, up to a cap of $500 for the first violation. And so all of that is available through the Shelby County website, and we can actually post that on our website so that people understand there were several amendments to that particular ordinance. It does allow us to have an interim action prior to closure, but if there are significant offenses, it could be a fine as well as a closure. What we have to do relative to protocols is have a clearly written protocol for the inspectors to follow, but that has to be approved by myself as well as the mayor and the county attorney. So we're in the process of finalizing that document and having it reviewed so that we can issue those citations in the future. And it does offer us an additional tool for enforcement. Thank you.
Mandy Rack, Fox 13.
Hi, good afternoon, everyone. My question is just about the vaccine. So I know we're focusing on the 1A1 population right now, but do we have a time frame on when we will be able to move into the next category of people, and just, what kind of people that includes, and really when the vaccine will be available to the general public?
Yeah, so I'm going to really encourage everyone to stay current, one by looking at Shelby.community website as well as the Tennessee Department of Health website, because the information is changing daily. What we do know is vaccines to public health specifically, because we're charged with many of the people who can get vaccine who are not in healthcare systems, and it's different in the metros than it is in the rurals. We're going to be highly dependent upon when we receive vaccine. And so right now we have sufficient vaccine to begin the 1A1 category, but because of our population and the number of people that fall into that category, we actually need additional vaccine to come in. So we may not move to the 1A2 category as quickly as somebody else, in part because we have to have vaccine. So please stay current on our website. We'll continue to give updates in the press conference. And then we do know that the state health department will be making some revisions to the categories. And why that's important is it may increase the time frame where people in the general public have access, particularly our seniors. So our anticipated ability to offer vaccine to some members of the general public should be in January. But again, that's going to be dependent on how much vaccine we receive. And we're committed to continue to provide updates, but knowing that it's a very fluid situation at the current time. And did you have a follow-up?
Yes, please. Who is included in the 1A2 population?
Okay. If you'll hold on, I'm actually going to get the list so I can read it directly from the state's information. And the reason I want to read it directly from here is so that there's not an interpretation on my part. So the 1A2 category includes all other healthcare workers with direct patient exposure. So that's primary care providers and staff of primary care, or I would say safety net providers, outpatient specialty providers, so that could be physical therapy, occupational therapy, and so on, pharmacists and pharmacy staff, those who do patient transport, any outpatient therapist, so again, that could be occupational therapy, it could be behavioral health therapy, and so on. Those who are in urgent care centers, those who do environmental services, that's a very, very broad category. Oral health providers, so that would be dentists as well as dental hygienists and dental assistants, and then the behavioral health providers. And then within that, we still prioritize that list that I gave earlier. So that's those individuals older than 65 years of age and those who fall into the list of other health conditions that make them more at risk. And then the Phase 1B category are those adults who have 2 or more high-risk conditions. And all of this is posted on the state website. And again, it may be revised from time to time. We anticipate a revision this week. I also know that we are getting a lot of calls from individuals who don't see themselves on this list, and so we try to make sure that when we get those calls, we're responsive so that we have a better understanding of where individuals would fall within those categories. Thank you.
Catherine Burgess, Commercial Appeal.
Hi, hope you guys are all doing well today. I wanted to first of all ask, we reached 580 hospitalizations due to COVID-19 today, the most we've reached in the pandemic. I'm wondering if you can tell me or give me a sense of how many of those are estimated to not be Shelby County residents. I'm trying to get a feel for the strain on the system due to surrounding areas, and I do have a follow-up.
Yeah, thank you. I apologize, but I don't actually have the current percentage of those that are outside of Shelby County. We can try to find that information out prior to the next press conference on Thursday. As you're aware, this has been throughout the pandemic. A good portion of our cases actually come from outside of Shelby County because we are a metro, we are a big community and have multiple healthcare systems. So we anticipate that we'll continue to have patients not only from surrounding counties but also from surrounding states. I just want to reinforce that our hospitals are making adjustments and they have surge plans in place to meet the needs of the community that they serve, which is actually broader than Shelby County. But we'll strive to have that information by Thursday.
Thank you. My next question, of course, the Safer at Home order was opposed by the town of Arlington, and in their letter, they specifically alleged that the data didn't support the Safer at Home order. And I'm wondering if you could talk to us briefly about what data you would specifically point to as supporting the decision to turn back to Safer at Home.
So I want to remind people we've used 4 gating criteria from the beginning, and that's consistent with national standards. What's the scope of the pandemic at the current time? And that includes things like the number of new cases per day. We jumped very quickly to somewhere around 299 new cases on average, to over 400 new cases on average, to well over 600, and then getting up in the 700s. So we actually were escalating very, very quickly in exponential growth. When you do the math, at a reproductive rate of 1.03 or 1.04, and then you look at the duplication rate, you're looking that a month out, we would have thousands upon thousands of more cases as a result of those particular cases. So we knew the pandemic was actually in a phase of exponential growth, and that was critical. Then we look at those other criteria. So testing capacity, again, we have done exceptionally well in testing capacity, so we didn't have any problems in that area. We also were looking at the hospitals that were seeing exponential growth in admissions, and their ability to respond to that was being really stretched. But we also had to look at what does this look like a month out. Not only, again, the number of cases, but the proportion likely to be hospitalized and the proportion likely to die, and how do we stop that from happening. And then lastly, we look at public health capacity. Again, we have been stretched throughout, but have made accommodations, increased staff, worked with partners to meet our public health obligations locally. So the key criteria was that our cases were growing exponentially, and that we had anticipated a significant growth in the number of cases and therefore deaths within probably a 4 to 6 week period. It was our responsibility to take action to reduce the likelihood of diseases and deaths in our community. So that is the criteria that we use. I'm aware of the document that came out of the City of Arlington. I've said before, elected officials have a right to their own opinion. I won't comment on their opinion. What I will say is that we are data-driven locally. The decisions that we make are not in isolation. Again, Dr. Randolph, myself, David Sweat, and other team members consult on a regular basis internally, but we also then work with other providers, particularly Dr. Jane, who's a consultant to the City of Memphis, as well as Dr. McCullers. We also have access to the state and other resources to make sure that, one, we're making a sound decision, but we do that in a timely manner so that we can reduce deaths and illness in our community. You have a follow-up?
I think that was her follow-up.
Okay, sorry.
Brad Broders, Local 24.
Thanks, Dr. Haushalter. I know I saw you yesterday with the first responders getting the vaccinations, but also the assisted living facilities. We saw some pictures and videos. Could you talk a little bit about the importance of those groups and those seniors and also the providers getting those vaccinations, how critical that is with, obviously the clusters they dealt with earlier this year?
So that's a great question, and I know nationwide there's a lot of controversy over who falls into what category, but the categories are determined on epidemiological data, and so you want to focus really on vaccinating two populations: those that are most vulnerable of becoming ill and having a resultant death as a result of the illness. And so that's particularly our seniors and those that are in congregate settings. And then you want to focus on those who are providers of care, because in providing care, they're at risk not only of getting COVID, but of getting it to others. So we really want to work closely to get our nursing home partners vaccinated and residents of those facilities vaccinated, because there have been clusters there, but we know just by the nature of the facilities, they're at high risk for transmission. And did you have a follow-up?
Yes, Dr. Haushalter, very quickly. I know the data is changing and the twice weekly reports from the state, but right now Shelby County lags some other metro counties in the percentage getting vaccinated. I guess maybe a response to that and just the ongoing effort you all are leading to make sure that we can get the highest percentage vaccinated in the coming months.
So a couple things to keep in mind, because Shelby County as well as the other 5 metros are a little bit unique, and so it's difficult to compare us, say, to the rural counties. And the reason I'm saying that is a large portion of vaccine actually went to the healthcare systems. In a rural county where they don't have a big hospital, everything's being done through public health. So that we have to look at the data on a regular basis and see what's being done by healthcare systems in Shelby County as well as the health department. We obviously just started vaccinating yesterday, and so I just ask people to continue to monitor, but also to make sure that we're all getting factual information out about the vaccine so that more people who are eligible to get the vaccine can go ahead and take the vaccine.
We are out of time. Are there any closing messages today?
Just want to reinforce to everyone that we know this is a challenging time for everyone. We do believe by the current restrictions we can allay serious illness, but also reduce the number of deaths in our community. So just want to thank Shelby County for all of your efforts to make this a healthy community for all, and then remind people, if you can, to donate blood. Thank you.
Thanks, everyone. We'll see you back here on Thursday.